Okay, I am ready.
Okay, so if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient?
This patient should be managed according CRISP protocol.
Okay.
That mean airway. I should check the patency of the airway on, and also I should put 12 liter of oxygen.
Yes,
Then I will check the breathing and trachea central or not.
yes,
And also I will check the air entry bilateral and auscultation of the heart and lung. Or also I should do percussion on the chest. Uh, Also I should check the auto saturation. Then I will go to C. I will check the blood pressure and pulse. Also, I should insert a large port cannula and give IV fluid, 20 ml per kg as bolus. Then I will reassess the patient again. Also, I should take CBC, kidney function, electrolyte match, ABG. Also, I should stop every epidural injection. Also, I should then I will take the cross match and insert full scatter to evaluate the urine output.
okay,
Also, I disability according to if she is response or not. Then exposure, whole exposure of the patient, and see if there is any bleeding from the lump area of surgery or the wound itself. Uh, yes, this is my.
Can you please tell me what do you think is the cause with which patient is suffering from?
This patient could be not spinal, yeah, spinal shock. Could be spinal shock or hemorrhagic shock.
Okay, right. Please tell me how would you okay,
So,
right.
a neurogenic or spinal?
Okay.
Uh,
Right.
that's
Can you tell
yeah.
me, because when you are managing the patient, how would you make sure that patient is getting better and not worse? What sign and symptoms would you look out for?
By checking the capillary fill, blood
Okay.
pressure,
Yes.
the extremity colors, if it's pale or not,
Yes. And
and the temperature of the extremity, also the conscious level and urine output, and
okay.
hemoglobin level. Yeah.
Yes.
Also, we can in this situation, if it is a spinal shock or a neurogenic shock, we can give her an ephedrine or epinephrine or even atropine also.
Can you suggest why would this patient be having bradycardia?
Because the patient have a high spinal epidural
Block.
epidural anesthesia block,
Yes.
so it is block the cardiac center may lead to block the sympathetic input to the heart, and that not antagonize the parasympathetic supply to the heart.
Okay, there are certain different levels which are chosen deliberately for certain different surgeries or procedures. Can you name few?
Certain level of what?
Yes. Uh, okay, this was block at T3, T4 level, and
Yeah,
according to you, this was a higher
high.
epidural block.
Yeah,
Okay,
higher one.
for certain procedures, certain other procedures, they choose different levels. Can you name few levels?
The L4 level on the iliac crest level.
Yes, L4 for
Uh,
what? For
for
thigh,
the lower
lower,
for the
high and lower leg.
lower
Leg.
limb. Yeah,
Okay,
thigh and limb.
and
Also,
L2,
bear.
L2 for the foot and ankle. And
Okay.
tell
Uh,
me if you could remember more.
it is L2 and it could be spinal. I cannot remember.
Okay, T3 for upper abdomen, T6 for intestinal, gynecological and urological procedures, T10 for vaginal delivery or hip surgery, etc. And S2 to S5 perineal and anal surgeries. Okay, can you tell me why is it important for you to check the temperature in this procedure?
To check the temperature, to evaluate the sensory level and
Yes.
the efficacy of the block.
Okay, good. Right. Please tell me, what are the advantages of choosing epidural block?
Advantage of the epidural block,
Yes.
it decrease the pain post-operative and improve the ambulation post-operative also.
And
Uh, and less invasive. Less invasive. This is for decrease post-operative and improve the
patients,
ambulation and decrease the VT.
yes, patients who have already cardiovascular disease. So this choosing going over this procedure, it reduces their risks. Also, people suffering from respiratory, it does not have any respiratory side effects. So it helps for those patients. All right. Please tell me, when and why would you choose the level of block? Or choosing the level of block depends on what?
Depend on the site of surgery
And
and kind of the surgery,
yes.
and also and the condition of the spinal cord itself.
Okay, right. So you have to consider the dose, duration, and the position of the
Yeah, sure.
patient. So
Yeah, this is the
these,
factor
yes.
affecting the spinal, the position and dose and concentration and type of the block.
Okay, do you agree with the statement that this epidurus, epidurasis, is it epidurasis? Yes. No, epidurals, they improve the outcome of the surgery. Is this true or not?
Yes, true. To improve the outcome of the surgery, also decrease the recovery of the patient.
Okay, what are the factors which affect the efficacy of epidural block?
The site, the level of the
Yes.
epidural,
And
also the dose of the epidural and
yes,
posture of the patient and
yes,
age of the patient.
height,
Also the
weight.
muscle yeah, and
Yes,
muscle content of the
yes.
patient, muscle mass.
Okay, can you tell me if there is a way you can test the block, the level of the block?
It's by bene break or by temperature.
Sensation, yes. And then how would you differentiate high epidural block from hypovolemic shock?
In hypovolemic shock, the extremity is pale and dry and tachycardia.
Yes.
In spinal shock, there is bradycardia, hypotension, and warm and pink extremity.
What are some of the systemic effects of epidural analgesia?
Systemic effect, if it is inside the blood, it lead to a neurological side effect and cardio and respiratory side effect,
So it,
including
yes,
cause numbness around the mouth, also
okay.
paresthesia around the mouth. Also, it lead also the convulsion or coma
Hypertension, it
and
causes
hypertension.
hypertension. Yes, due to,
In early phase, it cause hypertension, but
yes,
lately it cause bradycardia and hypotension and
yes,
cardiac depression and respiratory depression.
yes, because it reduces the cardiac output. Right, okay. Reduction of post-operative DVT, deep venous thrombosis, and okay, good. Right. If there is any more question, okay, right. I think I've covered everything. I think I've covered everything. Yes, good. Right. Thank you.